Hello,
Good
Amy. How are you?
evening. Yeah, good evening, Amy.
Hi, how are you doing?
Good. Hope you're doing well as well.
Yes, yes, happy to be here.
Yeah. So let's begin our session with Amy Berger. And let me give a brief introduction of Amy. Amy Berger, MSCNS, is a US Air Force veteran and certified nutrition specialist who specializes in helping people do keto without the crazy. She writes about a wide range of health and nutrition related topics. Amy has done extensive work in bringing the spotlight back on Alzheimer's disease through her research and thesis on the subject. Besides her two other bestsellers, Amy is also the author of The Alzheimer's Antidote, using a low carb, high fat diet to fight Alzheimer's disease, memory loss, and cognitive decline. With me here is Anup Singh, the founder of T-Life, India's oldest, largest, and the only award-winning low-carb platform. Now also with the diploma course in low-carb nutrition and metabolic health, the biggest in the world with 60 CPDRs credit. Welcome, Anup. Welcome, Amy. And let's start the session.
Yeah.
So,
So,
Amy, tell us, yeah,
yeah,
Anup, please
please
go
carry
ahead.
on.
I just wanted to begin by asking Emmy, why is the Alzheimer's disease increasingly being called type 3 diabetes now? I think we should start with that premise already.
Okay, yes, thank you. And I just want to say what an honor it is to be here and especially to have followed Georgia Eade. She and I have actually collaborated a little bit with trying to educate people about Alzheimer's disease and the metabolic aspect. So the the fundamental problem in the brain of somebody with Alzheimer's disease is that the brain has lost the ability to properly metabolize glucose. So, and glucose is a main or major fuel for the brain. So, if the brain is not taking up and metabolizing glucose properly, then we have what I call a fuel shortage or an energy crisis in the brain. And because it's specific to glucose, and things like type 2 diabetes and insulin resistance dramatically increase risk. I think this is why they refer to it more often as type 3 diabetes or diabetes of the brain.
Anup.
Yeah, so if I understand correctly, it is basically a metabolic disorder, more of a metabolic disorder rather than genetic one.
Yeah, there is obviously a genetic component to this. If anyone watching is familiar with the ApoE4 gene, that is the strongest known risk factor for Alzheimer's. But millions of people around the world have the E4 gene and never develop Alzheimer's. And of course, millions of people who do not have the E4 gene do develop it. So the E4 gene does increase risk, but it doesn't cause Alzheimer's. That gene appears, it's believed to be the oldest form of this ApoE gene, and it evolved during a time when our diet and lifestyle was very different. So it's not that the gene causes the disease, that gene is just a mismatch for the way that we eat and live in the modern world. And like I said earlier, yeah, the metabolic aspect is a far greater risk factor to either have type 2 diabetes or not be diagnosed as diabetic, but to have chronically high insulin, which is the precursor to diabetes.
Okay. Yeah,
Yeah,
next.
so if you're saying that this is uh, a metabolic kind of spectrum, a metabolic disease more than the genetic factor involved in this, then the entire spectrum of how we are looking at the Alzheimer's disease and the way it's being treated, understood, and care is being given is totally contradictory to what you're saying, Amy. Please elaborate on this.
Yeah, that's right. And I think this is part of why we just don't see anyone really getting better from Alzheimer's
Mm,
disease or their cognition improving when they implement the standard treatment, which is really just medication. And the medications target the symptoms of the disease, not the underlying metabolic factor. And I before I say anything else, I do just want to state for the record that many other issues can contribute to cognitive decline or cognitive impairment that are not necessarily related to the metabolic aspect. For example, a vitamin B12 deficiency can cause neurological and cognitive problems. Statin drugs some of them are well known to cause memory loss and confusion and interfere with cognition, and even hypothyroidism, if it's improperly treated over the years, can cause cognitive decline. So if somebody watching is living with this or has a relative living with this, it's not automatic that they have this metabolic aspect. Those other things should be ruled out first. And those are actually very easy, I think, to rule out with simple blood tests. But yeah, getting back to your question, I think you're absolutely right. If we have a fundamental misunderstanding of the disease process, then our treatment approach is also going to be completely wrong. And I think this is why the medications for Alzheimer's are basically useless. They really don't do much to, at best, they slow the progression at best. They don't retard the progression. I mean, they don't stop the progression from getting worse, and they certainly don't actually reverse it and help restore cognitive function.
So are you saying, Amy, that insulin resistance, therefore, has a role to play in the Alzheimer's disease?
I believe that it does, and I think the published evidence to date indicates strongly that it does. You know, we know by now, or at least our low carb community knows, that insulin resistance is a risk factor. It either causes or makes worse a huge list of issues, and it really affects every part of the body. And so why would we think that the brain is somehow immune to these metabolic disturbances? It's like Dr. Eid always says, the brain is part of the body. So of course, anything that has a pathological impact on the body is going to also affect the brain.
Anu, would you ask the next
Yeah, with the
question?
current paradigm of treating Alzheimer's, you said, you cannot reverse it or put it into remission. You can only slow down the progression. So if that is so, then are there any other options being looked at by the mainstream practitioners?
I can't speak to the mainstream practitioners, but I certainly know that within our low carb and ketogenic community, there are a number of researchers studying ketogenic diets for Alzheimer's. And I do have to say, in the US, the Alzheimer's Association has funded some of this research. So it's interesting, but also kind of heartbreaking that if you go to the Alzheimer's Association website, there's really no mention of this at all. There's no mention of the glucose metabolic problem in the brain. So I don't think that the mainstream has embraced this yet, but certainly there are researchers and nutritionists and dietitians who are aware of this metabolic aspect.
I mean, I heard you say in one of your videos that when you started writing your thesis and you went through the evidences, and there were lots and lots of them that were kind of buried and hidden away, so to say. Why do you think that has happened? And why did nobody ever look at that kind of spectrum that would really change the way such a critical, a mental disorder or Alzheimer's, so to say, can be treated or can be looked at?
That's a great question, and I can only speculate as to why. It is kind of a mystery as to why this isn't more widely publicized. And it could have to do with, Alzheimer's seems to be so mysterious and so complex that it's hard to believe it could be as simple as just a fuel problem in the brain, or that
Correct.
fueling the brain in a different way could potentially help this. So I think that's part of it, is that it's hard for doctors or researchers to believe that it's maybe not as complex as we think it is. I also think that there's been so much focus on the amyloid and the amyloid plaques, and maybe we can talk about that in more detail, but it was sort of established, and I use the quotes because I'm using that term loosely. it was established that these beta amyloid plaques were the cause of Alzheimer's. So once that was taken to be a fact, even though it's a very weak fact, and I think it's actually fundamentally incorrect, then all of the research dollars and all of the efforts have been put toward targeting the amyloid. And it's a very, very parallel and similar story to cholesterol in cardiovascular
Yes.
disease. And I know you've
Yes.
had some specialists on in this event where when, decades ago, people thought, oh, high cholesterol and especially high LDL is causing heart disease, then we need to do everything we can to target that molecule, when that hasn't really gotten us very far. And I think it's almost the same story when you look at the amyloid. And that's why these other avenues of research have not really gotten as much attention.
Nope.
Can you please, highlight more on the damaging aspects of statins? Because that is one of the most profusely prescribed drug, and people are unaware essentially that what damages it can do to brain.
Right. So, of course, I just want to caveat that I'm not a medical doctor, I'm not a cardiologist, but this is well documented in the published literature, including, again, on the US FDA website, the Food and Drug Administration. They state very clearly that a potential side effect of statins is memory loss, confusion, and cognitive problems. And I think that is probably because the brain is full of cholesterol, all the myelin sheaths that protect the neurons. And the brain is a very, very cholesterol hungry organ. And so when we take a drug that limits the production of cholesterol, we're going to be in trouble. And there are certain types of statins that have a greater risk for this, and they are called the lipophilic statins, the ones that more easily cross the blood-brain barrier. They tend to have a greater impact on cognitive function. But these drugs, we have to weigh the risks and benefits of lowering cholesterol against impairing cognitive function. And the risks of lowering cholesterol are very questionable, or the benefits of lowering cholesterol
Yes.
are sort of questionable in themselves.
So the clinical symptoms of Alzheimer's manifest much later than the actual process has, really started. Maybe in the 30s, the 40s. Is there an early way to find out the possibility of having Alzheimer's later in life?
Another great question. I mean, you're exactly right. The memory loss and the cognitive impairment problems are a late development in this disease process. There are some, intense type of tests that you can do to actually measure the brain's uptake of glucose. It's a PET scan, and they would inject you with some radio labeled glucose, and they will see how much the brain is taking up. Of course, that's not something you would have done at a normal doctor's office. So
Yes.
I think if we believe that insulin resistance is a very strong risk factor for this, then I think even some of the standard blood tests can tell us early on if we're sort of on the path to this, like a fasting insulin, which is not done anywhere nearly enough. I think it should be a routine part of standard blood work. But the hemoglobin A1C, the triglycerides, the blood pressure, any of the metabolic syndrome type criteria, if those are getting out of place, you can assume that you are increasing your risk. And I do just want to emphasize again, like you said, this is not a disease of the elderly. This is something that starts happening in a much younger age. And it just,
Yes.
when you're young and you're healthy, your brain can compensate. But the brain, that decrease in the brain glucose metabolism starts, like you said, in 30s and 40s. And it's
Yes.
only when it's become so severe and it's gone on so long that the brain cannot compensate, that's when you start showing the symptoms. So this is something that we all need to be aware of at a much younger age.
Yeah, if AD, as you said, it's primarily a problem of glucose metabolism. So in that case, ketones, one way of pushing ketones is to go for low carb and keto diet. Now, if that is so, if that is so, then this is split into two parts. If ketones can, do what the glucose cannot. So why is it, people say that brain functions on glucose, so you have to eat carbohydrates? That is question number one. And question number two, how does ketone help where glucose fails?
Okay, what was the second? How do ketones help?
Yeah. In what sense? As a fuel. I mean, to highlight that, I would say glucose is a dirty fuel versus ketones from fat is a cleaner fuel. So can you
Okay,
highlight on that?
so yeah, so the first, if I remember them in the right order, um, the brain does require some glucose. I think there's a reason that our blood sugar never goes to zero. Even if somebody's eating a zero carbohydrate diet or close to it. So the brain does require some glucose, but that doesn't mean we need to eat carbohydrate to get that glucose. Our bodies are very good at making glucose from other things. So we can get all the glucose the brain needs without eating carbohydrate. And if you are on a very, very low carbohydrate diet, then the brain's requirement for glucose actually reduces because, like you were saying, ketones can meet some of that fuel demand. So to whatever extent we're fueling the brain with ketones, we need that much less glucose. So it's true, you will never hear me say that the brain doesn't need any glucose. There's no evidence yet that ketones can fuel 100% of the brain's needs, but it can fuel some. So we need less glucose. And I mean, the most promising thing in the research on ketones for Alzheimer's is that even though the brain has lost the capacity to take up and use glucose properly, it still takes up and uses ketones. So we can at least close that fuel shortage a little bit, maybe not 100%, but a little bit, which could potentially improve somebody's cognitive function and quality of life, and their families and caregivers' quality of life.
I primarily asked
Yeah.
I primarily asked this question, in the backdrop of Dr. Mary Newport's research on her husband. If you remember that she had experimented with, I think, virgin coconut oil or something, and her husband was a typical Alzheimer case, and she reported some improvement because of that.
Yeah. So if just the quick version, if people here are not familiar, Dr. Mary Newport's husband was diagnosed with Alzheimer's, and she was a neonatal specialist, medical doctor. So she was already aware of the impact of ketones and medium chain fats to help the brain for newborn infants. And knowing what they did for the brain, she said, let me see, maybe it will help my husband. And she started by putting coconut oil on his oatmeal. So he was not on a low carb or ketogenic diet, but
Yes.
just adding the coconut oil helped her husband's cognitive function a little bit. And over time, she increased it. I think she may have switched to MCT oil, and eventually she used the ketone ester, which is one of those exogenous ketones, which is where you can have elevated ketones even if you're on a high carb diet. And he had a remarkable improvement. I mean, they wrote a paper about it. It was stunning. Unfortunately, to be fully honest here, he did lose his life. He did pass away a few years ago, but in the time that it may have been that his disease state was too advanced to really reverse, but at least in the time that he had left, his quality of life and cognition was much better. Her quality of life as his caregiver was better. So it's just so promising, and there is no drug that does that. There's no Alzheimer's drug that has been shown to do anything close to that.
So let me ask you, Emmy, a very pointed question. Can Alzheimer's be reversed or slowed down with low carb keto diet in that case? Or are the years of damage done by hyperinsulinemia make Alzheimer's disease difficult to reverse or slow down or retard?
I think it's a very individual basis. I think if it's identified in the very early stages, there's a chance that cognitive function can be restored. In the later stages, I think, like we just said about Mr. Newport, you might be able to improve cognitive function in the short term, but it's not going to stop the progression, and it won't save somebody's life. But it's something to remember is that, like we said earlier, by the time you get diagnosed, you're actually in a late stage. The early stage is the hyperinsulinemia long before you have any cognitive problems. And I feel like it's the same with Parkinson's disease. It's the same with some of these other neurodegenerative disorders that have a lot of overlap with Alzheimer's. By the time the damage is severe and widespread enough that you get diagnosed, this has been brewing inside for years. So I think that's probably part of why it's so difficult to make a dent in this. But I think it's always worth trying, because to whatever extent you can close that brain fuel gap, you you just stand the best chance. If it can be reversed, that stands the best chance of doing it. But again, I think it has to be in the earlier stages to have even a chance of fully reversing it rather than just kind of improving function.
I mean, just to make it clear to our viewers, can you tell us the difference between or the similarities between Parkinson's, Alzheimer's, and what they call dementia? Can you
Right.
describe
So
the entire spectrum? Yes.
yeah, dementia is a larger category that includes things like Alzheimer's disease or frontotemporal dementia, Lewy body dementia, vascular dementia. There's a lot of different things that can cause cognitive impairment, but when you start looking at the molecular level and what the problems are in these cells, they almost all have the reduced glucose metabolism in common. It's actually fascinating because I think it means that there's a rationale for trying a ketogenic diet or exogenous ketones in any neurodegenerative condition. There's just so much overlap. They almost all have some amount of reduced neuronal glucose metabolism, and hyperinsulinemia or insulin resistance is a risk factor for all of them too. So it's like I said earlier, we it's almost like we're ignoring the
Yes.
impact of these metabolic problems on the brain and nervous system when we know they affect the kidneys and the eyes and the liver and even the prostate and the ovaries. And we almost ignore even the possibility that the brain is every bit as susceptible to this damage as the rest of the body is.
Nope.
Yeah. How does intermittent fasting, does it help in AD, if at all, and how?
It could potentially, because if somebody is eating less often, then we're giving the body more time to come back to a normal blood sugar level and a normal insulin level. I don't think that intermittent fasting by itself would do a lot to affect the disease. But if you're doing a ketogenic diet and incorporating fasting, then that might make it even more powerful. But if somebody is elderly or frail or already underweight or undernourished, then I don't encourage any kind of fasting. But again, fasting could help in the sense that you will spend more time in a lower insulin state. But I don't know if somebody's eating a very, very high carb diet and just doing some intermittent fasting, I would not expect that to have a huge
Yeah.
beneficial impact.
So, Emmy, I wanted to ask you about amyloid as you spoke early on. So amyloid beta has an important role in the pathogenesis of Alzheimer's because the appearance of amyloid beta occurs many years before the plaques and clinical symptoms actually show up in a person. Is it a reliable marker for AD prediction, or do anti-amyloid beta monoclonal antibodies that have now been developed help in the treatment of AD at all?
So I think the amyloid, unfortunately, has misdirected decades of research efforts and money, because there are, just like with the ApoE4, there are, amyloid is a normal thing. Everybody's brain produces amyloid. The problem in Alzheimer's is that it's not cleared away efficiently. So it builds up and accumulates and forms these plaques. And the thing is, there are millions of people who have a high plaque burden. They have a lot of plaque, but they don't have Alzheimer's. And there's a lot of people who do have Alzheimer's who, upon autopsy, when they examine this, they don't have a lot of plaque. So if you can have Alzheimer's without a lot of plaque, and you can have a lot of plaque and not have Alzheimer's, then the plaque cannot be the cause, or at least not a major cause. It's just like the cholesterol and heart disease. And every single drug that has been developed so far to target the amyloid is effective in that it does reduce the amyloid. Those drugs are very effective at reducing amyloid, but what they don't do is improve cognitive function. So if we clear away the amyloid and somebody's cognition does not get any better, how can we say that the amyloid is the major factor? It's, in fact, years ago, a phase 3 clinical trial of one of these drugs had to be stopped early because people on the drug were doing worse than the people on the placebo, and it was deemed unethical to continue. So I just think, I mean, it's my opinion based on what I've seen, but it's also the opinion of many of these researchers that this amyloid is just the wrong direction. And it's honestly heartbreaking to see this avenue be pursued over and over, and these other far more promising things like ketogenic therapies are either being ignored or they're getting much, much less attention.
Yeah, Anup, carry on, please.
Yeah, since you talked of keto, right, are there any specific foods to include besides MCT and all the oils? And how does keto compare with carnivore?
Carnivore is a separate topic. Amy, I
That
think
we
you
will
should
take.
really emphasize that, because a lot of people are not, they are generally not aware of the dietary spectrum that has to be looked into when we're talking about these conditions, and especially carnivore and keto. Low carb is fine, but carnivore, how does that help?
Yeah, I can't say there's really been any research comparing a ketogenic diet and a carnivore diet specifically for Alzheimer's. I mean, maybe 50 years from now that might happen, but right now, I think in terms of including certain foods, you're right that I would include coconut oil or some MCT oil. And if, just in case people watching don't know why, those particular oils contain special types of fats that your body converts into ketones, even if you're eating a high carb diet. Like we said with Mr. Newport, Dr. Newport put coconut oil on his oatmeal, and that those oils alone can elevate ketones a little bit. But in terms of other foods to include, I am not of the opinion that there's any such thing as a superfood or some type of food that's especially good for Alzheimer's. But what I can say is I do think it's important probably to include some fatty fish to get those omega-3s for the brain, include foods that are high in B12. So that could be things like shellfish or red meat or eggs for people who are vegetarians. What you really need to do is meet those micronutrient needs. And I think there's a way to do that across a spectrum of foods, but I think that omega-3s and B12 are especially important for the brain.
I mean, why is there no dietary guideline prescribed for, such conditions like Alzheimer's? I mean, you do you do have dietary guidelines given for diabetes, for heart conditions. Why is there no guideline given for, such conditions?
Well, I'm kind of glad there's none, because I personally think that the recommendations, or the conventional and standard recommendations given for diabetes and heart disease, are very harmful.
Yeah.
So I would not want to see a potentially harmful or incorrect guideline for Alzheimer's. But I think it's because we're not certain what causes this. And if we're not certain what causes it, then we're not certain how to prevent it. I strongly feel that this hyperinsulinemia metabolic syndrome aspect is huge. Is that the only or the major cause? I don't know. That we haven't determined that yet. So what you hear mostly is the Mediterranean diet, right? Follow a Mediterranean, eat lots of whole grains and beans and vegetables. But where's the evidence for that? There's no it just sounds good. There's no evidence for it. What are people in India supposed to do? Are you supposed to eat the Mediterranean diet when you live in India? So, I mean, it's very unscientific, I think.
Yeah, I've been with these people. I've been a caregiver, a voluntary caregiver. And I absolutely believe you, Amy, when I recall those times and I remember how they were fed high carbs. I mean, there was no awareness of protein, no awareness of what to give. So lots of seed oils, lots of high carbs like rice and wheat and all of that. And there's really no regulation as far as this spectrum is concerned. I don't know. How do you see it going in the future?
I think it's probably going to be a similar situation to what's happened even for diabetes and weight loss, where it will be a grassroots effort where individual people will just like we're doing right now, start spreading the message, sharing the message. And social media is so terrible, but so wonderful at the same time.
Yes.
And people will start to find this. And there are isolated places where low carb and keto is being used for Alzheimer's, or individual people are finding this information for themselves. I know of a gentleman in Arizona in the US who runs some assisted living facilities who's using keto diets, and the results are phenomenal. But he's just one person. But I do think this is spreading, but it's very, very slow. And I think part of that is because even if somebody finds this information, it's like we said earlier, it would be if you don't understand the biology of this, it would be very easy to say, oh, that diet can't possibly help my grandmother's brain, or that diet can't possibly help dad's Alzheimer's. I can absolutely understand why it's almost impossible to believe that if you don't understand what we've talked about here.
I mean, do you have your book with you at the moment? And can you please show it to us?
I can. Oh, it would take me a minute to get one.
Yeah, do that, please.
Oh, you want
I
me to?
think
Okay,
that would
hold
help.
on. Let's see if I can get it. Oh my gosh. Okay. Good thing I knew right where it was.
Yeah.
So this is the Alzheimer's antidote. And if I had this to write again, I would probably call it Keto for Alzheimer's, because it would have been more popular. But this is the book, everybody. And
who should be reading it, Amy? Who should be reading it specifically?
Anybody who has a family member living with cognitive decline, who is concerned about how to help them or how to potentially prevent this from developing in their own body. And anyone who cares about cognitive function, cognitive health, anyone who wants to learn about the brain and why specifically a keto diet is very good for the brain. And I will say, I have there's an entire chapter in here on the statin issue. There's a whole chapter on B12. And there are chapters also on debunking the myths about cholesterol and red meat and saturated fat. Because if I'm telling someone to eat a diet that goes against everything they've heard for the last 60 years, then they need to feel safe and feel like this is something that is not dangerous to try.
And is that available on Amazon?
It is, yes.
It is. So people who would want to buy that book can buy Amy's book from Amazon. And Amy, just one last small question. people who are caregivers to Alzheimer's or dementia patients, would you give them a few tips to begin with? I know that that entire spectrum is very confused because of the conflicting advices being given, and medicine's not helping. Plus, the stress on the caregiver is too much. So that's why these people are sent to daycare centers and then brought back, which I again think it's a professional help, but it's so unethical because the entire way we look at this is going in the wrong direction already. So what they do to start with, simple tips?
Yeah, let me first, like you said, acknowledge the just the efforts and the hard work of the caregiver. I mean, that is
Yes.
my credit, my respect to anyone who is dealing with this situation. If the affected person's food supply is out of your control, there isn't much you can do. If they're already in an institution or a facility, there isn't much you can do. If their food supply is within your control, then do the best you can to implement a ketogenic diet with them. Now, of course, that is very difficult sometimes, but I think it helps if the whole family is on board. You can't have this one person eating differently from everybody. And of course, the whole family can follow a low carb diet. This is a healthy, safe way to eat for just about anyone. And if you can't implement an actual ketogenic diet, then I think that there is a rationale for using exogenous ketones if they're available where you live, and certainly coconut oil or MCT oil. Let's at least give the brain a little bit of fuel any way we can. So I would say that try to get the whole family on board. If not with strict keto, then with some amount of a lower carbohydrate diet, and then definitely make sure that this person is getting some ketones, and explore those other things I mentioned earlier. Make sure that there's no B12 deficiency, no undiagnosed
Yes.
hypothyroidism, and yeah.
Anup, would you like to say something to Amy as a closing shot? I think Shashi's also here. He can unmute himself and we can chat a bit.
Please bring Shashi in, and Amy has been with us, I think twice you have been on our channel earlier. So this is the third interaction that we are having. And as a parting, I mean, what's the message that you would like to give to India? Because India has become a country of consuming, unlimited amount of seed oil because it is heart healthy, right? And lot of sugar because brain needs sugar. That is the general conception. So misconception, I would say. So what is the parting message that you would like to give to this country?
A very low carbohydrate diet is not anything radical. It's not anything dangerous. It's simply good, wholesome food minus the sugar and starch. And if
Yes.
you are currently eating a very high carb diet and you are unhealthy and you have a lot of medical issues, then that's not working for you. Even if you've been told that's what you're supposed to, lots of grains and lots of fruit. If it's not working for you, then why not try something else? And it's something else that thousands, if not millions of people around the world are thriving with.
I mean, just one line question. Should people with Alzheimer's be given fruits or not?
Yes.
It's that has to be an individual type of thing. I think berries are probably okay. Strawberries, raspberries, those are the lowest sugar fruits. There's nothing that you can get. There's nothing specific in fruit that will help the brain that you can't get from lower carbohydrate vegetables, whether it's vitamin C
That's a
or
very
potassium. You can get all of those vitamins and minerals from plant foods that are lower in carbohydrate.
that's a very critical point.
Yeah, but there's
Shashi,
everything.
anything?
Yeah, but there's everything in the fruit which can kick up insulin.
Yes.
Yeah, please bring Shashi in. Shashi, yeah.
Yeah, so Amy, thank you very much. So we have a long-term association with D Life. We have been interacting with each other in various forums, including I've been interacting you even in Dr. Eric Westman's KMS Keto Made Simple program also.
Right.
So there is a question here from the front end. Someone has put in a question. I'll just take this. Would an elderly lady with advanced dementia, unable to perform any activity, including speech, movement, except probably for eating, swallowing, would benefit from ketogenic diet and kept on intermittent fasting? So this is the actual question from one of the viewer.
Well, there's only one way to find out, and that's to try it. And because here's the thing, if you try it, it's either going to help a lot, it's going to help a little bit, or it's not going to help at all. I don't see it making her situation worse. But if she is that severe and the disease is that advanced, it may be better for you to use the exogenous ketones, which are going to really give that brain a lot more ketones than she would probably get on a ketogenic diet. And with regard to the intermittent fasting, you could try that. But again, if this person is frail or underweight, I would not recommend deliberately going any specific amount of time without food.
Yeah, I think that's very valuable. And I think India is a land of coconut oil. So it does
And
provide
ghee,
good
I mean,
amount.
ghee is such a great fat
Ghee,
too. Use
yes.
ghee.
I said coconut oil is because of the MCT, medium chain triglyceride. It can immediately get some ketone or a purified one, MCT oil, or ketone esters. If they have relatives abroad, they can as well get and try. And I think these are all good interventions. So, Emmy, thank you very much for your insightful session. And I think with the neuropsychiatric diseases on the rise in India, which includes both neurology and psychiatry, I think somewhere they converge with each other. I think these insights are very, very valuable. And thank you very much for sharing your insights on Alzheimer's disease. I'm sure it
Of
will
course,
go a
thank you.
long way. People,
Amy, you've certainly brought the spotlight back on Alzheimer's because, as I told you, I've been working with these people and we never knew this. And now when I look back, it's so heartbreaking to see what was being done to these people. And I really recommend Amy's book. I think that will clear off a lot of doubt, give a lot of clarity to caregivers, and help them deal with the situation much better. Thank you, Amy. Anup,
Yeah,
anything
thank you.
that you would like?
Thank you, Ami. Thank you for coming. We'll interact
Thank
a
you.
lot
Thank you
more.
for having me.
Bye-bye.
Bye-bye.
Thank you.